regarding this meeting, I think one of the main papers reported is the HD16 trial by our group, which looked at PET-adapted radiotherapy in early-stage Hodgkin lymphoma after 2 cycles of ABVD. Patients PET negative were randomized to either receive no further treatment or in the standard arm received consolidated radiotherapy, and in line with previous findings from the H10 rapid trial, we could show that there is a loss of tumor control due to an increased rate of in-field relapses. So the consolidated radiotherapy does add to a favorable PFS also in those patients who are PET negative after systemic treatment. And therefore this somewhat remains standard of care, at least in our point of view, and this is something which is now been shown in 3 large randomized phase 3 trials. Obviously there are reasons to differ from this standard of care in individualized cases, such as a young female patient, for example, with a large mediastinal tumor which would have relevant radiation exposure to her breast or coronary arteries. But when just looking at the data, one would say that there's a loss of tumor control, and this is, I think, very important to acknowledge. Other interesting data were the combination of Brentuximab vedotin with nivolumab in the setting of pediatric and adolescent patients, which showed a favorable safety profile and really remarkable response rates, including a high rate of metabolic CRs prior to the planned autologous stem cell transplantation, and therefore this is something which is really a great treatment option for those patients. And data is not mature yet, but what we have seen at this meeting at least is very promising. And in terms of data to look forward at ASH, I think what's going to be very interesting is the phase 2 NIVAL trial, also by us from the German group, which is looking at nivolumab and AVD in combination, either sequentially or fully simultaneously in the first-line treatment of patients with limited stage disease. And the trial finished recruitment. The early data is looking very promising, and we are looking forward to show it at ASH.